I went in to have my gallbladder out, and the surgeon that did my gallbladder came out and he said, surgery went great. However, I found cancer.
That diagnosis just 20 months ago started 71-year-old Kim Valdez on the crazy cancer ride to stay alive.
And they diagnosed me with stage 4 ovarian, which was pretty scary because they said, you know, we can treat stage 4, but we can't cure it.
Our first treatment was to give her chemotherapy, actually, a combination of a couple of different drugs that are really considered standard treatment in this case. Because of the data in those trials that we talked
Kim's case turned out to be anything but standard. After a total of 18 rounds of chemo.
18 rounds of chemo, yeah.
Doctors found answers illustrated by these yellowing photos.
My mom had died of colon cancer 2 months before she turned 43. Pretty darn young.
Kim had the same mutation in her DNA, making her a candidate for immunotherapies.
That patients with these mutations, MSH6 and a few others, respond very, very well to immunotherapies, meaning treatments that are designed to help your own immune system recognize and kill the cancer cells.
This is called targeted treatment, or precision genomics.
That involves taking small sample or biopsy of a patient's cancer and then looking at the DNA in that cancer to identify the genes causing the cancer to grow. We can offer patients new treatment options, which in many cases means new hope, and access to cutting-edge care.
How cutting edge is it?
It's completely transforming medical oncology.
Cancer is a disease.
It works like this.
The cell stops dividing in a structured manner.
Doctors extract DNA from those cells and then map them using sequencing technologies. When a specific mutated gene is discovered, oncologists can use targeted drugs to deliver personalized treatment. The key to unlocking more cancer mysteries could lie behind this garage door. Here on the campus of LDS Hospital, Intermountain has stored nearly 5 million tissue samples, encased in wax and frozen in time. Each tissue sample is a small window into how a patient fought their disease.
We believe that the answers to how we treat patients in the future are locked away in these samples from the past.
Intermountain started collecting these samples in 1975 from all 22 of its hospitals. After 10 years, they're shipped here and stored in this temperature-controlled basement. This treasure, or biorepository as they call it, provides a map to make predictions about the future.
We think the reason that asset is so valuable is because we can pull a sample out and now apply some of these new DNA sequencing technologies and do a whole genome analysis.
This is kind of the key, how the DNA is actually sequenced.
Back in St. George at the Precision Genomics Lab, these brand new state-of-the-art $1 million machines do all the heavy lifting, or sequencing.
They can sequence DNA faster and better than ever before.
Just 10 years ago, sequencing one genome, which contains about 20,000 genes, would take years.
These targeted drugs suppress tumor growth.
Once the mutated gene is identified, doctors develop a treatment plan for the patient.
You're not having any more of your belly pain or anything, are you?
For Kim, that was immunotherapy and a new drug.
This is magic, and I've been really, really lucky. No side effects, none.
And unlike chemotherapy, she's kept her hair.
Life is good. I was just like, wow, this is wonderful. Targeted therapy.